one of the big remedies of our Materia Medica and an emergency remedy that every homeopathic doctor or every homeopathic consultant uses in his day-to-day practice. So this remedy is Aconite Napellus. So how Dr. Phatak explains is we will going to the decode the his all symptomatology and drug picture. So uh, just one common things. How many times does a patient comes and says, "Doctor, it started suddenly. Doctor, I was absolutely fine yesterday. Doctor, I feel I am going to die." Now, let me tell you that it is just anxiety, or it is just a panic attack, or it's just only a fever, or it is aconite standing in front of you. So, when disease comes suddenly with fear, aconite is already in present of you. Simple sentence that explains the whole picture of aconite is disease comes suddenly with fever. Fear. Disease comes suddenly with fear. Fear is marked in aconite nephalis and suddenness. So, what we should know while studying the aconite nephalis? Aconite. If you miss aconite, you miss the beginning of the disease. And in homeopathy, beginning decides the end. Means in acute situation, you miss the aconite, then the patient trust on you is going to patient trust is going to not on you. So at the beginning, your end is there. So according to Phatak Materia Medica, the aconites defined by rapidly acting remedy means aconite is rapid rapidity of action. The word is rapidity of the action. So this word has been we decode it as a symptoms come suddenly. Symptoms come suddenly. Symptoms are intense. Symptoms are violent. Symptoms doesn't last long. So symptoms comes suddenly, intense symptom, violent attack, and not last for a long time. So, aconite never creeps, it attacks. Means that aconite never comes slowly, it's directly comes from an attack. So, core of the aconite or essence of the aconite in simple sentence is sudden shock of vital force producing intense fear. Sudden shock to vital force producing intense fear. Everything else comes later. This line is very important. Sudden shock to the vital force producing intense fear. So, aconite is not slow, not chronic, not vague. It is a storm remedy. It comes like a storm, just like a thunderstorm. It comes suddenly, creates chaos, leaves quickly. Aconite is not disease, it's a reaction of the human system. So there is most important causative factor that aconite while prescribing the aconite in our day-to-day practice uh, one should not miss or one should not forget these things in their day-to-day practice. The causation based remedy, it's a causation based remedy. So, did this start suddenly? Was there fear or fright, any shock, bad news, cold air, or wind exposure? So, before prescribing these 4 to 5 questions may require. So, what are the questions? Did it start suddenly? Was there fear or fright with him? Is any shock? Is any bad news or exposure to cold, dry wind or cold, dry weather? So, causative factors of pointers strongly that indicates the aconite. Causative factor that strongly indicates the aconite are sudden fright, sudden shock, emotional trauma, cold, dry wind or cold, dry weather, sudden change of temperature, आणि checked perspiration. Checked perspiration. These are the mainly 4 to 5 to 6 causative factors of aconite. Fright, sudden shock, cold dry wind, emotional trauma, sudden change of temperature, and checked perspiration. Even remote effects of fright matters to the aconite. So these are the main pointers or causation of the aconite. While studying the mind symptoms of aconite, I should remember the one Indian movie Sholay. In that, Amjad Khan has a famous uh, uh, dialogue in that movie, uh, that जो डर गया वो मर गया. This type of situation in the aconite patient. That's the intense fear of death. If the aconite fear have intense fear, and most fearful remedies of our materia medica, not mild fear, not anxiety, or it's a agonizing fear that presents in the aconite. What kind of fear that aconite has? We can see fear of death, fear of future, fear of crowds, fear of crossing the roads, fear of touching people. This fear is out of proportional to that disease. Fear is out of proportion to disease. If fear is bigger than pathology, think of aconite. One word, how fear describe aconite's fear. The fear is bigger than its pathology. So this fear looks in the OPD that aconite patient does not sit quietly in OPD. They scream, they moan, they groan, they grieve their feet, bite nail, become frantic. So they may say, in OPD situation, they don't stand. They may say, or their version to us is that, doctor, please do something fast. Doctor, I am not going to survive. I want to die rather than suffer. So, aconite patient suffers twice, once from the disease and another from the fear. So, aconite has also restlessness, but different from other. Aconite restlessness is driven by fear, driven by panic, and driven by death anxiety. So restlessness is due to the fear, panic, and death anxiety. It is not like a arsenic restlessness, which is due to the exhaustion based, or Rostock's restlessness due to the pain based. Key difference is aconite have mental restlessness, emotional storm. So, how can we see the child in the OPD, or how can present a child in a OPD to diagnose the aconite? Aconite is very important remedy in the children's practice. Typically, sudden fever at night in children, screaming, restless, wants parents constantly, puts hand on the affected parts. These are the sudden rise of temperature, sudden fever at night due to the exposure to cold air. Screaming, restless child wants to parents constantly, puts hand on the affected part, especially in the earache. Patient constantly picks his ear on the affected part. Parents of aconite child may say, doctor, my child was perfectly fine in evening and suddenly he develops the symptoms. So a golden rule to prescribe aconite in children is fearful children, sudden night fever with fear is aconite. Sensitivity and hypersensitivity of the aconite, how can we describe that? Aconite patients are hypersensitive. Hypersensitive to what? The noise, light, touch, and pressure. All these four things aggravates aconite patient. In acute fever or in aconite conditions, these are, if any loud noise, light, touch, or pressure comes, they will become panic, or their symptoms may get aggravated. Why this happens? Because the aconite have overexcited nerves. Due to the overexcitement of nerve, these are our symptoms develop. So aconite is acute of nervous overdrive. Aconite is acute of nervous overdrive. So these are the commonly in children's fever. Then another is earache. Then due to the any situation in the morning happen to the school, fearful or other, and evening suddenly child gets fever. That in that cases also we can think of aconite. Time modality or aconite is in time situation. How this we can correlate with this is aconite symptoms come suddenly, stay shorter duration time, and disappear suddenly. So disease becomes if in disease have slow, dull, long lasting, aconite is never indicated like gelsemium. Gelsemium has slow, dull, long lasting illness or conium maculatum. So aconite belongs to the first chapter of, not the last. It is the first come to the our armory. Common mistakes while prescribing aconite. In chronic diseases, without fear, without sudden onset, or just because of fever is present. So when not to prescribe aconite? No suddenness, no fear, no aconite. No suddenness, no fear, no aconite. So, in this, we can see that the sudden shock, intense fever, aconite storm is the characteristic of aconite mentality or a generality that we can describe in three words, that suddenness, fearfulness, and storm. So you can catch aconite early when you see a save case. If you miss it, disease goes in the deeper state. So sudden shock, intense fear, acute storm. So aconite is not just a medicine; it's a reaction of the body to the sudden shock. Sudden onset, intense fear, emotional storm. So physical state of aconite Nepalis. What aconite patient actually sees that aconite patient looks actually ill, not tired, not weak, but violently sick. The appearance of the patient is important while selecting the aconite. It is not tired, it is not weak, but it is violently or extremely sick. So, key general impressions of aconite is hot patient, dry, restlessness, congestion, overreactiveness. These patients cannot lie quietly. Aconite patient looks worse than they diagnosis suggest. In temperature and heat, aconite is a hot remedy. Dry burning heat, skin hot to touch, wants to uncover, does not tolerate blankets. But remember that heat is dry, not sweaty in early stages. Sweats comes later. Aconite burns before it sweats. So aconite is worse by cold dry winds, sudden chilling while sweating. Sudden chilling while sweating is a characteristic example in our day-to-day practice, that patients who in the summer season patients have outside the house or outside the in the market, and they sudden come in the AC while they are sweating, and sudden chilling happens, and sudden fever or sudden any complaints happen, or they come sit in the car and start chilled AC and the symptoms develops. This is the right time to prescribe aconite, especially midnight. Noise aggravate, light aggravate, touch and pressure aggravate, inspiration aggravate, lying on painful side aggravate. So what gives relief to the aconite? Open air, rest, warm sweat, lying quietly on the back, that relieves the aconite. So in pain, how do you differentiate pain of aconite from others? The pain of aconite is sticking, tearing, cutting, and burning. It is not a dull pain. Aconite associated with pain, tingling, pricking, crawling, and numbness sensation. Mm, Parts may feel that too large, deformed, heavy internally, sore externally. So, aconite pain frightens the patient more than injuries the tissue. So aconite in head section, the congestive picture of aconite or congestive headache that have sudden onset, crusting, throbbing, pulsating, pulsation is visible. Patient says that doctor, my head feels like it will burst. Associated with hot band around head, boiling sensation in the brain, worse by any movement, light, noise, pressure, and vertigo on rising. So, acute congestive headache, early hypertensive crisis, or panic headache. Uh, in acute hypertensive crises, I use aconite mother tincture. It is due to the sudden shock, emotional trauma, or in suddenly, if the patient is not hypertensive, but due to any conditions, he becomes hypertensive. Then 5 drops of aconite mother tincture in half an hour, patient decreases his blood pressure and all his symptoms. Eyes, ear, in eyes, dry, hot eyes cannot tolerate bright light, sensation of sand in eyes, conjunctivitis after foreign body. In ear, extremely sensitive to noise, music's unbearable. In ear, it is a first choice of remedy in sudden acute earache in children. Smell, acutely sensitive to smell. Aconite has heightened all his senses, heart and circulation. There is one of the strongest organ affinity to heart. Sudden palpitation, anxiety with heart pain, pain radiating to the left arm, faintness, tingling in the finger, pulse, fast, bounding, forceful, irritable. So, in heart, you may see these all types of symptoms that pain, anxiety, palpitation, due to the acute panic attack, acute myocarditis, or tachyarrhythmias, or early cardiac inflammation, or in the myocardial infarct. In aconite, the heart races because of the mind terrifies him. In respiratory system, aconite is the first stage remedy in all respiratory symptoms. Sudden onset, dry croupy cough, barking, whistling cough, worse at night, worse while inspiring, acute laryngitis, we can give croup condition, early pneumonia, early pleurisy. Patient sits upright, feels suffocated, grasps his throat. Aconite works before exudation, not after. In the respiratory exudation, it is before exudation we can have to prescribe aconite. After that, you can belladonna, ferrum phos. In gastrointestinal system, in stomach, intense burning thirst, vomiting with fear and sweat, projectile vomiting, milk disagrees. Abdomen, extremely sensitive to touch, colic with no relief in any position. Patient has no relief of colicky pain in any position, with intense fear, with panic, the in renal colic or in pancreatitis. Aconite gives instant relief if all these situation have there. Only for pain, aconite doesn't work. You have to be storm, suddenness of pain, fear, anxiety, restlessness. You can give aconite. In higher potency, I will give 10 one dose and wait for 10 or 15 minutes. Diarrhea in children during hot days, urine scanty, hot perspiration, urine scanty, hot, painful urination, suppressed urination in newborn after cold exposure. In urinary symptoms, sudden suppression of urine, you may give aconite. Aconite GI symptoms are inflammatory and sudden, not a chronic. Skin and fever patterns of aconite. Fever pattern, sudden high grade fever, dry burning heat, uh, chill passing in waves, wants to uncover, sweat later, often on uncovering parts. Skin dry, hot, sometimes icy cold sensation. Aconite fever announces itself loudly that I am coming. In children, sudden night fever, high temperature, restless, crying, sleeplessness, hands on the affected parts, as I already told. Uh, oh, in aconite patient, night onset aconite children, their onset is mainly at night, that I am observing. Don't prescribe aconite. There is slow fever, disease is established, discharges has been begun, no fear or restlessness. Once pathology settles, aconite leaves. Means if there is settle the any pathology, you aconite never works. That I seen in many cases. So next part we see that core or differentiation between the other remedies with aconite. We can differentiate aconite with many other acute remedies. That differentiation is very important for the aconite. First remedy in our mind that comes is differentiate need to is belladonna. So aconite has fear of death, anxiety, restlessness, wants company. Belladonna is violent, rage, but no fear. Does not want to be disturbed. These are the common differentiation. No fear and does not want to disturb. And violence. Aconite has fear of death, anxiety, restlessness, wants to company. So fear present, aconite. Fear absent, belladonna. Simple differentiation. Aconite and arsenic album. Aconite has sudden onset, recent fright, fear of death, strong vitality. Arsenic has slow exhaustion, chronic anxiety, fear of being alone, weak vitality. So, sudden storm, aconite, chronic burn or chronic exhausted state, arsenic album. Another remedy we can differentiate is gelsemium. Aconite is restless, pranky, hot, dry. Gelsemium is dull, drowsy, heavy, trembling. So, excited, fear, aconite. Paralysis of fear, dullness, drowsiness is gelsemium. So, by causation, we have to differentiate aconite. Fear and shock, aconite. Exposure to cold, dry wind, aconite. Bad news, aconite. If the causation is absent, think twicely while prescribing. So, causation confirms the aconite more than pathology. So, what are the main causes? Fright, shock, exposure to dry, cold weather or wind, bad news. According to Phatak, clinical experiences, complementary remedies are coffea when sleeplessness from excitement remains. Sulfur is the aconite. Sulfur when acute aconite becomes chronic. In many cases of aconite patient, sulfur is uh, means in acute state of sulfur patient, we can give aconite. So aconite's chronic is sulfur or sulfur's aconite is acute is aconite. So sequelae example is aconite turns into the sulfur. Related remedy belladonna after stage of aconite. Chamomilla irritability replaces fear. In aconite, fear. Chamomile has irritability. Coffee has nervous excitement without fear. So, aconite opens the case, or the other remedies complete the case. When aconite fails, many of doctors blindly prescribe aconite. So, disease is chronic, no fear or panic stage, pathology is well established, suppuration has been started, patient is exhausted, not excited. So, when fear burns out, aconite retires. A simple word, fear burns out, aconite retires. So potency selection, as early as I have told you, in many of the cases 30 and 200 works very nicely. In severe pain, colics, we can give 1 m, and in hypertension, in acute, due to the causation that I have already told, that due to the suddenness, aconite mother tincture works better. So when highlights of the aconite, as we study for a long time, we have to remember aconite within 5 to 6 lines, or recall the aconite. So sudden onset, recent fright or cold exposure, intense fear of death, restlessness, dry heat, and hypersensitivity. No suddenness, no fear, no aconite. No suddenness, no fear, no aconite. Don't use aconite for any fear, any anxiety, or chronic panic diseases. Or do not repeat aconite unnecessary. Aconite works fast, stops when storm settles. So, always confirm while prescribing aconite causation, fear, and suddenness. So, in one line, highlight or core of the aconite: sudden shock, intense fear, acute inflammation. And 3 words: sudden, fear, and storm. So aconite teaches us one great lesson: treat the beginning correctly and the descents never grow. Aconite teaches one lessons in the homeopathic practice, that treat in the beginning correctly and the disease never grows up. So this is all about aconite. Thank you for patiently listening. Thank you. We will see in the next session.